Hello everyone, good afternoon everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart all the time is a quest of humans. Right from the beginning of civilization, few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne is a common skin condition that can impact anyone, whether you are a teenager or an adult. The skin condition complaint is no stranger. Knowing the various types of acne can help you treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just a skin ailment to various psychological disorders such as depression, anxiety, stress, and low self-confidence. Hence, it is important to know about the holistic treatment approach of this ailment. So let's connect today with our skin expert, Dr. Barnita Gupta, live from Rohtak to talk on acne and use of sunscreen and moisturizer in acne. Dr. Barnita completed her MBBS and followed by MD DVL from Lady Hardinge Medical College and associated hospitals. She has participated in many national and international conferences and has publications and research articles on her name. She believes in fostering a strong doctor-patient relationship, ensuring that each individual receives a personalized and compassionate care. Dr. Barnita stands as a beacon of expertise and compassion in the healthcare community. Thank you so much, Doctor, for joining us today. It is a pleasure to host you today.
Thank
Doctor,
you.
first question for you would be, before we start sunscreen and moisturizer in acne, kindly let us know about what is acne.
Acne is basically inflammation of the pilosebaceous unit and is characterized by open and closed comedons. Some even have papules, pustules, nodules, and cystic lesions, and even few patients have excessive scarring. So it is basically a kind of infection and inflammation of the follicular unit, basically.
Right. Doctor, who can generally develop this?
Mostly 80% of the cases, the most common age of presentation is between the adolescent, that it starts by 13 to 14 years of age and usually subsides in 80% by 25 years of age. But the rest 20% can get acne even post 25 years of age, which we call as adult onset acne, or even before the age of 14 years, which can be a mid-childhood acne or a neonatal acne.
Doctor, what can be the general cause of it?
Basically, it is characterized by four pathogenetic mechanisms. That is, first, there is an inflammation which is going on in the pilosebaceous units. Second most common is a cornybacterial acne infection, which is a bacteria which resides in our skin microbiome. The third most common cause is there is follicular hyperkeratinization. That is, our hair follicles gets blocked up with the pores gets blocked, and there is an inflammation going on underlying, which gives rise to acne. And the fourth cause is seborrhea, that is increase in oil secretion.
Right. Doctor, I think the next question is from all our viewers. How can we manage it?
Management is a broad thing for acne. We as a dermatologist look into the severity first. There are various grades of acne, that is mild acne, moderate acne, and severe acne. So the treatment response varies according to the type of acne. So if someone has very mild type of acne, we only give topical treatments in the form of creams, lotion, gels, which can be adapalene, benzoyl peroxide, or clindamycin gels. If someone has moderate acne, then we, along with the topical, we add oral therapies also, which can be oral antibiotics or oral other kind of retinoid preparation. And in severe kind of acne, again, we have to increase the oral medications along with topical treatments.
Right. Doctor, as we know, diet seems to play a role in acne. Is there any science behind? If so, what kind of diet can worsen or improve acne?
Yes, definitely. Recently, various studies have shown that diet has a direct link to acne. So diets which are rich in high glycemic index carbohydrates, dairy and milk products, chocolates, and even some kinds of sugary products can all increase acne. The pathogenesis which is linked to acne is that when we take high intake of this kind of diets, there is increase in insulin like growth factor like hormones in our body. So these hormones act on certain receptors in our cells which upregulate the acnegenesis in the form of increasing the oiliness or seborrhea as we say, increasing lipogen synthesis, increasing inflammation in the tissues. So ultimately all this lead to acne. So
Right.
yes, and improving the diet also helps in decreasing the acne. So if we take more of omega 3 rich fat, omega 3 rich diets which are rich in flax seeds oil, chia seeds, fish liver oil, soya bean. So this all improve acne because they decrease the insulin growth factors basically.
Okay. Okay. Now that we know that our diet plays a very important role in
Yes.
acne and its management. Doctor, I think our next question is also a concern for many. Can makeup be used in patients with acne?
Ideally speaking, we as dermats don't recommend it. But yes, in our day to day life, because we are all working some way or the other, so yes,
Right.
you can use lightweight makeups, but you should take certain precautions and look in what formulation or brands you are using. So you should use brands or formulations which are liquid based, gel based, non comedogenic, and you should check these levels before you buy or apply the makeup. And you can also consult your dermatologist, show your skin type, show your acne grades. Then the dermatologist also suggests you the best makeup which you can use.
Right, right. That's what we always recommend, to consult your nearest expert. And today, as again, we are trying to explain the same thing here. That before coming to a conclusion, please consult your nearest expert. Doctor, our next question for you is: does derma cosmetic play a relevant role in treating acne?
Yes, derma cosmetics are nothing but basically a skincare products which are formulated and certified by dermatologist and is a part of our skincare routine daily, which has certain active ingredients like salicylic acids, glycolic acids, or niacinamide, which can improve our acne per se. So there are various derma cosmetics brand in the market. If you use it on a regular basis in our day-to-day skincare routine, it also helps in improving our acne. So yes,
Right.
they have a role.
Right. But speaking about the products which are available in market, how does one know if that product is fit for him or her? How do we
That
understand that?
is what comes the role of where comes the role of dermatologist. Yes,
Right.
so you should check up your skin and refer to a dermat according to your skin. They will suggest you the best one which is there in the market.
Exactly. Now, doctor, we'll move on to our next question. What is the importance of moisturizer or moisturization in acne prone skin?
Yes, moisturizers nowadays play a very important role in acne because, first of all, when patients are started with treatments of acne, so the medications that we write, like adapalene, benzoyl peroxide, all are known cause of irritant reactions. They also cause dryness, they also cause redness in the skin, itchiness in the skin. So, all these cutaneous reactions can be subsided if you apply a moisturizer beforehand. So
Right.
there comes the role of moisturizers. Otherwise, also in acne per se, also there is an epidermal damage which is going on in the skin. So if you don't apply a moisturizer and just keep on treating our acne, so the overall skin does not improve. So there is a role of moisturizer in acne, both for getting treated for the acne also and also for maintaining our skin hygiene.
Right. Speaking about moisturizer, doctor, I have heard a lot of people saying that it's very much important to moisturize your skin on a daily basis.
Yes.
Uh, Also, there are a lot of people who has a mentality like people who belong from the humid regions. Suppose
Hmm.
I am from Kolkata, the weather here is mostly humid.
Yes.
So I have met people who have this conception कि यार इतनी गर्मी है मॉइस्चराइजर लगाएंगे और स्किन ऑयली हो जाएगा और स्वेटी होगा. तो नहीं लगाने से, ऐसे तो ऑयल सेक्रेट होता ही है ऑयल से, स्किन से, सो नहीं भी लगाने से चलेगा. सो व्हाट डू यू हैव टू से टू दोस पीपल विद सच सॉर्ट ऑफ मेंटालिटी कि मॉइस्चराइजर लगाना नहीं लगाना आई थिंक नॉर्मल है इन द ह्यूमिड रीजन्स?
No, even if it is humid, you can use a lightweight moisturizers. So there are medicated moisturizers which are there in the market, which
Right.
according to humidity less or more, we can change the formulation. So, but you should be applying a moisturizer even if you have acne, even if you are more of oil secretion, because moisturizer will help in not only improving your acne, but will also maintain your skin epidermal damage loss, which keeps on daily occurring on a daily basis.
Right. Doctor, as we are talking about moisturizer, can we also explain the procedure, the process of applying, moisturizer on our skin? Anything before that or after that we need to apply on our skin?
Yes, like first you wash your face with a cleanser, gentle cleanser, or a face wash as recommended by your doctor. Follow it up with a good moisturizer based on your skin type. So if you have oily acne prone skin or you are residing in a very high humid areas, you can use gel based or water based moisturizers, which are best having a non-comedogenic levels, and even the moisturizers which are paraben free, dye free, color additive free. That is what we recommend if you have a very sensitive or oily skin. So yes, that is the second step after a cleanser. Follow it up with a medication if told by a doctor, and then a sunscreen. So
Right.
that is the layering technique.
Right, doctor. Well, from this live today, we are trying to cater a lot of knowledge so that even if you are trying to manage your acne or it's not in a serious stage, you can be beneficial from today's life. A similar kind of question, doctor, comes for you next is which type of moisturizers should be used for acne and acne prone skin? Or is there any particular ingredient we are looking for or any particular composition we are looking for?
We should use basically, as I already told, a gel based or a water based moisturizers are preferred. Ingredient is that you should look for certain labels that is written, that is non-comedogenic, light free moisturizer, non greasy moisturizer, and certain uh, free from certain preservatives like alcohol free, dye free, color additive free. So these are the things which you should look for. And yes, if it is you have acne and oily prone skin, certain ingredients like if it is good in hyaluronic acid, zinc based moisturizers, these are better if you use such kind of moisturizers.
Right. Thanks to the technology, we have a lot of products available in market. We have got a lot of choice on the basis of our skin. And as you all know that we are always available to help you out in that matter. Moving on to our next question, doctor. Our next question is what factors do we need to consider before we start moisturizer? Which before we select moisturizer?
Uh, Before you select a moisturizer, you should look that if you have an oily or an acne prone skin, the factors that you should look into is that it should not have any rich paraben rich products. It should not have high alcohol contents in the formulation. It should be octocrylene free, para-amino-benzoic acid free. And if the composition is written that it is lightweight, non-comedogenic, then it is better for your skin type. So you should look into all these things.
Right, doctor. Now coming back to another important question, importance of sunscreen in acne.
Yes.
What can be the importance of it?
Sunscreens, otherwise also as a routine care also, it prevents us from sun damage, photo damage, aging skin. So in acne also, because the skin is already in an inflamed state, so to prevent photo damage, further photo damage, signs of skin aging, we should use it as a routine thing. Otherwise, in acne per se, when we use treatments of acne on our face, like topical adapalene or benzoyl peroxide, these are phototoxic or photoreactive molecules. So if you do not follow it up with a sunscreen, it can cause more irritation on our face, more redness, more burning. So to circumvent that problem, we use sunscreens. And in acne also, there is post-inflammatory hyperpigmentation or spots appear once the acne clears off. So to prevent it from further darkening or an uneven skin tone also, you can say, we should use sunscreens on a routine basis.
Speaking about sunscreen, doctor, how many times should we apply sunscreen on a day?
Ideally speaking, sunscreen should be reapplied every 2 hours, starting from right 9 a.m. to 10 a.m. in the morning to 3 p.m. in the afternoon. And if you are working in a very sunny day, you are going outside or you are doing very high physical activity, you are taking a swim bath or a hot steam bath, so the sunscreen gets washed off. So after that, you can also reapply it. So ideally speaking, you should reapply every 2 hours.
Right. And what can be the quantity of it?
uh, there are certain methods which we can correlate how we should use it. Like you can take either 2 finger length, whole 2 finger length for the entire face and neck, or you can we say it as a half teaspoonful rule, like a half teaspoon of sunscreen for the full face and neck, a half teaspoonful for one of each arm, and a full teaspoon for each legs and back and chest. So that is the rule.
Right. That was very helpful. And I think that measurement was on spot, doctor. Now we'll move on to our next question. How do we start layering with, how to do layering with sunscreen while using acne treatment?
Yeah, first is again cleanser or the face wash, followed by the moisturizer. Moisturizer should be followed by any topical treatment that is given by your doctor. Usually we give it at night, so yes, in daytime you can skip it. And the last thing that to be applied is the sunscreen. And if you are using any makeup or day creams, CC creams or BB creams, follow it up after the sunscreen, not before.
Right. Doctor, our next question, I think it can be a concern for many. Can sunscreen and moisturizer be used in pregnant or lactating mothers?
Yes, it can be used. There are special formulations for them, like physical sunscreens, which are usually zinc oxide and titanium dioxide based. These are preferred in pregnant and lactating females because they don't have any carcinogenic elements in them. And even for moisturizers, which are lightweight moisturizer without very high alcohol content, that can also be used in pregnant and lactating females.
As you're mentioning, doctor, are there any harmful moisturizers or sunscreens that can be, harmful for pregnant ladies? Are there
Uh,
anything?
there is no direct study which correlates directly. Yes, they are harmful to fetus, but yes, the one which is very rich in certain preservatives like paraaminobenzoic acids, octocrylins, parabens, this should not be used in pregnant and lactating females.
Right, right. I think that was very helpful. And now we'll quickly move on to our next question. I think this question is better not to be asked, but then we would definitely want to know from you, doctor, any lifestyle changes or home remedies to be done in reducing acne?
Lifestyle changes do have a great role in acne. First is you should not take too much stress on very small things, which is the foremost thing in our today's life. So second is having a very good and healthy diet, which is free from sugars, high fats, oils, spices. Third is a little brisk of physical activity daily in the form of a little brisk of yoga or an exercise you can do. So all these remedies can help in your day-to-day skin functioning also, and in acne and oily skin also.
Right.
Fourth is you should also, if there is any problem, instead of just starting any kind of home therapy like applying any lemon juice or tomato juice, you can just consult your doctor, because we as dermatologists don't recommend such kinds of home based therapies. It is the treatment of the dermatologist will help you in the long run, not the home
Right.
run.
Right. Well, being in an Indian society, we are used to, घरेलू नुस्खे. We are so
Yes,
much
yes.
used to it. कुछ भी हो कि घर पे बेसन लगा लो बेटा, मक्खन लगा लो, आप कुछ भी लगा लो, खाना कोई भी वेस्ट हो जाए, कोई भी फ्रूट वेस्ट हो जाए, स्किन में लगा लो, बाल में लगा लो. We have a normal tendency,
Yes.
but then again, our expert today and we as well, we are mentioning it again and again. If you are suffering from something, make sure you do not come to a conclusion. Make sure you visit your nearest expert. Doctor, also speaking about lifestyle, healthy lifestyle, we have heard कि आप जैसा खाओगे वैसा आप दिखोगे.
Yes.
The kind of food you intake, you will exactly look like that. आपका lifestyle जितना healthy होगा, आप उतना better दिखोगे. In fact, आपका longevity, आपका life का longevity भी उतना ही ज़्यादा बढ़ जाता है. We have heard it. And with time, somewhere or the other, we have seen that it's coming becoming true. We have seen a lot of people in the society as it is scattered now. आधे जन हमने देखा है कि आजकल फिटनेस बहुत ज्यादा कॉन्शियस हो गए फिटनेस के प्रति लोग. Also, we have a lot of people who are very much inclined towards food, and you know we have so many bloggers and food reviewers. चाहे वो पैसा ही कमा रहे खाने से, but somewhere or the other it is affecting their health.
Yes.
Coming to the other class of people who are very much fitness conscious, and somewhere or the other doctor fitness के तरफ इतना inclined हो गए हैं वो लोग कि fit होने के लिए कोई भी कुछ भी intake कर रहे हैं, चाहे दवाई हो, चाहे अपने skin को plump करने के लिए botox use कर रहे हैं. They are doing everything for their body and their skin. Doctor, how much can those pills or whatever we call them in the market, how can those be harmful for our health?
You should not take it. If you have better to consult an expert if you are suffering from any issue, or otherwise also just for a routine thing also, if you want to take it under an expert guidance. This is what we say. Like if you don't have any problem and you just want to take a pill for your glow and uneven skin tone or whatever it may be, that is, yes, there are certain drugs which you can take, but you should know what are the side effects and what are the pros and cons of taking those, and under the guidance expert review only you should take it, not on your own, because on the long run these are not safety if you use it on a long run basis.
Doctor, also coming to another important point which we usually don't discuss, for all the ladies and women who tend to take pills to stop their menstrual cycle, can that be harmful as well?
Yes, there are these are basically hormonal preparations which we are talking of.
Right.
So these hormonal preparations are known to cause acne. So if you are suffering from any kind of gynecological issues and you are taking pills for such concern, you should tell your doctor also if you are suffering from the side effect of acne, there are alternative options to those drugs or pills also which you can take, which will not cause any harmful effects. So
right.
Yes.
With that, doctor, we have a question coming up from our viewer. Advik Singh asks, how often do I cleanse my face and what type of cleanser do I use?
Okay, the best cleanser we can tell about after looking into your skin type. Otherwise, for a normal individual, you should cleanse your face 2 times a day. That is the ideal most. And gentle cleansers, which are usually sterile and alcohol based, that is what is preferred, and you should do it 2 times a day with a normal water only.
Right. Doctor, we have another question coming up from Pooja Sharma. Pooja asks, Doctor, do I use sunscreen daily, and what is the SPF level of sunscreen I can use?
Yes, sunscreen should be used daily, whether it's a sunny day or a non-sunny day, or it's raining or a cold, humid environment, you should use it daily. The minimum SPF that we recommend is 30 or above, because 30% SPF 30 means it will reflect 97% of your sun rays from your skin. So that is the standard that we follow. Higher the SPF, it's much better. But yes, if you increase the SPF much higher, the composition of the chemicals in the sunscreen also increases. So you should weigh both the things. SPF 30 or above is the standard.
Right. Doctor, because we are talking about sunscreen again and again, and we are talking about protecting our skin, isn't it important to also, be in the sun? Isn't it important for our skin as well?
Yes. We as a dermats, we say that yes, in the sun you should also go out, and vitamin D synthesis, which we say ki whenever we go out, we have vitamin D synthesis. So yes, we should go out in the sun also, but we should apply sunscreen also. Studies have shown that if you apply a sunscreen, it is not that your vitamin D is going to be deficient in your body. It will otherwise be generated in a 1 or 2 minute exposure to sun. So yes, you should go out, but wear a sunscreen.
Right. बहुत ही इम्पोर्टेंट बात आज हमने जाना है. जितने भी लोग हैं जो धूप से भागते हैं, प्लीज डू नॉट डू दैट. प्लीज आप एक्सपोज रहे सन के प्रति, पर अप्लाई sunscreen before you take the direct sun rays. With that, we have another question coming up from Purvi Mehra. Purvi asked, Doctor, how consistent are you using targeted skincare products? How consistent are you with using targeted skincare products?
You should use it on a routine basis for unlimited time, maybe I would say, because a good skincare routine will always be with you if you're using it consistently. So the basic thing is you use a good cleanser, a good moisturizer, and a good sunscreen. This is the basic skincare routine which you can use it for a long run. There is no stoppage or stop to it.
Right. Doctor, we know that maximum of our confidence it comes from our skin, our hair. Yeah. Mostly it does. So speaking about makeup, we have a tendency कि कहीं ना कहीं makeup confidence लेके आता है हमें, you know, and with time we have seen so many dupes in the market. We have already talked about makeup initially in this meet. But please, we would like to clarify this for all our viewers, for all the viewers who thinks कि Huda Beauty original बहुत expensive है, हम उसका dupe ले लेते हैं, वो भी कहीं ना कहीं near about, because the person who is selling those products, they do use, you know, such kind of marketing languages कि आप इसको use करो, original के जैसा ही है. This is what we get to hear all the time mostly. So what do you have to say to all those viewers कि चलो बहुत ज्यादा एक्सपेंसिव प्रोडक्ट के पीछे नहीं, कुछ सस्ता ही अप्लाई कर लेते हैं, इफेक्ट तो हमें वैसा ही मिलेगा? What do you have to say to those people?
What we say is a lightweight to mid coverage makeups are good. A high coverage makeup will always clog your pores. Right. So if it clog your pores, there is going to be some day or the other day some kind of skin problems. So a mid to low to medium coverage makeup is good. Then based upon the skin types also, nowadays there are ample of options in the market. For oily acne prone skin, you look for a particular type of liquid based foundation is what we say for oily acne prone or sensitive skin. Nowadays even mineral makeups have come up in the market. So that mineral makeups are not that costly, but these are good for very sensitive skins. So you should look into what exactly your skin type is and go for a formulation which best suits you.
Right, viewers, that's all we are trying to explain today. Choose your makeup wisely, choose your skincare products wisely. And if you are not able to choose, we have our expert always beside us. With that, I believe we have targeted almost all the questions, and I do not see any more questions coming up from our viewers. So, well, Doctor, that was a very, very interactive session. And we thank you for your valuable time. It was a very informative session for all our viewers, and it was great to hear from you. We look forward to many more such sessions for our viewers in the coming time. And thank you, viewers, for your excellent participation for today's session. Stay connected to our beautiful Spotless Skin page. Bye and keep glowing.
Okay, thank you.